You all signed up to join the community of practice. We asked you all for some feedback on what was working well, and what kind of things we might change as the community of practice keeps evolving. And there was lots of really lovely positive feedback. I think most of you were saying, actually, we really like how it works at the minute, so we would like you to keep doing the same kind of things. So that was really positive. Um, but we had a couple of ideas of things that you all wanted to see. So people wanted to have some opportunities for breakout rooms and some smaller conversations. So we're looking at how we can include things like that in future agendas. People also shared that the previous space for sharing recordings and resources was a little bit hard to access because you had to have an account to do that. So we're setting some space up on the Learn Disability England website where you'll be able to access that openly without a password. So hopefully that should be a little bit easier for you to get to. You'll also be able to share resources and things there as well. So if you have anything housing related that you would like to be included, you'd be welcome to share that. People talked about having some subgroups. We haven't got very far now thinking about that, but we can have a look at how that might work. There was a couple of suggestions for different topics people might want to come together on, but that might depend on how the agendas fall for the rest of the year too. People said that having an annual program would be really helpful. So we have dates in for the rest of the year. The next one is on the 16th of September, and then we have one on the 24th of November. So we're drawing some programs together for that. So we'll share those in advance so you have an idea of what you're coming to. But we're also hoping to keep a little bit of space in them for things that might pop up in the meantime. So we can keep on topic and the things that are important. A lot of people shared that they had things that they might want to contribute to future sessions. So we're going to keep making some space for everybody to be able to share the work that you're doing. And we're also going to have like a feedback form at the end of this session, and that's open so that you can keep sharing those opportunities that you have to, share the work you're doing as well. So we're going to keep building on all of that to hopefully keep this a really exciting thing to be coming along to. And if my slides will move on. The topics that you all suggested, we've got a couple that we're talking about today, but we've started building these into our planning for the next sessions. And the key themes people wanted to talk about were around housing rights, choice and control, supported housing regulation, hold, housing benefit, best practice models, the barriers and solutions to people getting their home, the design of supported living, how people with disabilities are heard in organisations, transition planning from inpatient settings, and also how all of our work around housing fits into the NHS neighbourhood model that's being developed at the moment. So those are some of the key things that we're going to be looking to talk about in future sessions, but we're always open to hearing your other ideas as well. So do let us know if you've got something you want to contribute to any of those. And I think that's me.
Thank you very much, Rachel. I'll now hand over to Jodie.
Okay, so now I'd like to introduce Mencap's family lead, Emma Austin, and she's with a family member called Phill. So I'd like to hand over to them, please.
Item by saying that, needless to say, this is the housing community of practice, and lack of suitable housing, as we know, alongside the right support, is a major reason why people continue to be stuck in hospital. So once we start thinking, right, that's terrible, we need to do something about that, housing is absolutely top of the list of things that need to be sorted. So it's important to say that everything we're now talking about for the rest of the session is relevant to what Emma and Phill have been sharing, and that when we're planning for people's housing needs, we absolutely must ensure that people who are stuck in hospital or at risk of admission to hospital are on that list. of people that we're thinking about. So that's the kind of the link that I just want to make with the rest of the agenda, if that's okay. So I think with no further ado, we're going to come on to yes. Sorry, I thought we were doing okay. Are we coming on to Viv and Jordan next?
Oh, sorry, that's just the next slide I've got on. There might be some.
Oh, I see. Oh, could we stop sharing slides then? And I think we're going to hear from John and Joe, who are going to tell us about the new supported housing panel, which they're both part of, and what that all means. If that's okay?
Okay, thanks, Claire, and thanks everybody. Can you see my screen that I'm sharing with you?
Yes, that's fine.
Can you
put
see
it on the slideshow at all? Or?
Okay, because yeah, I can't see it at all.
Yes.
So I've got it on slideshow. You should all have it on.
I can see that.
On,
yes.
On slideshow now. So thanks. That was a really amazing presentation. The last one, really poignant and powerful. So I'm talking today with John Verge about local supported housing strategies, a very brief overview from a supported housing advisory panel, which is a new advisory panel established by MHCLG, which is the Ministry of Housing, Communities and Local Government, to advise the government on reforms to social supported housing, particularly under the Supported Housing Regulatory Oversight Act. So the Supported Housing Advisory Panel has been formed as part of the Supported Housing Regulatory Oversight Act that came into force in 2023, and the government are now bringing in different elements of that act over the coming years, which will strengthen the delivery of supported housing. Members such as myself and John have been appointed to the panel for 5 years, but that can be extended for another 5 years. And our role is to provide expert advice to government. I work in my main job for Bristol City Council, and I commission and build specialised housing for people with learning disabilities and autism. And I'm also on the Learning Disability and Autism Housing Coalition, so well placed to hopefully advise the government on matters pertaining to housing and learning disability. We're looking to shape how the reforms work in practice, so we're advising the government specifically on their strategy implementation and also licensing conditions, which John will talk about a bit more later. And we're also providing our own advice, highlighting opportunities, but also risks and gaps in current planned work. And the panel brings together lived expertise, so 6 of the panel members are from the sector. So I'm working from a local authority, John works in a housing association, and other members belong to similar organisations like that. But 6 of the people on the panel live in social housing and have experience of what it's like to live in supported housing, and are supporting the panel to understand how the reforms they're bringing in will impact on the people living in that accommodation. And there's more information, including our terms of reference, at the website there. These slides will be shared after the meeting today. But what I'm talking about mostly today is local supported housing strategies. And I know we've got the excellent Joe Kane talking about these in a bit more detail later, but just to give you a very brief oversight as to what these are. The supported housing strategies are a new requirement on local authorities. So at the moment, a lot of local authorities and the government don't really have a very good understanding of how much demand they have in their local area for supported housing and what that demand looks like, what types of needs are there in their sector. And you need to know those 2 things to plan to supply the right amount of supported housing for the right people in the right area. So, you know, it helps us to plan for supported housing supply, which is really, really important given the conversation so far today on this meeting. And they're going to be really in-depth pieces of work which are going to take place over the next year, and are going to really analyse the gaps and pressures and risks of not providing enough supported housing. So these strategies will set out the priorities for future development. They will enable local authorities and the government to understand what type of supported housing is needed and where it's needed, and the type of provision that's needed. So is it for people with learning disabilities, autism, or other multiple disadvantage or complex needs? And we can start to plan for the scale and location of new provision. Some local authorities are already very good at this. Some local authorities understand quite well the supply and demand requirements in their area, but a lot don't. And no matter how well a local authority currently understands its own supply and demand, this isn't feeding through to central government, and those are the people that ultimately decide how things happen and provide the money to make things happen. So this will bring together lots of different stakeholders from across the sector, housing colleagues working with colleagues in adult social care like me, and health colleagues in our integrated care boards, ICBs and the NHS. And the aim is to develop a system that's less fragmented and more planned and strategic. So instead of having pockets of extremely good delivery and pockets nothing's being delivered at all, for the whole country to be operating on the same standard with a good understanding of the type of housing needed in those areas. And ultimately, through these strategies, it's up to the local authority to put them together. And if it isn't visible in the strategies, then it likely won't be planned for. So it's really important that groups such as these and all of the groups within this group advocate and campaign with your local authority to ensure that they are making clear in their strategies the requirement for housing for people with learning disabilities and autism. So for this type of housing, it really is important to recognise that there's inconsistent quality across provision. Some places there's incredible quality housing, and other places have got almost no specialised housing at all. There's a limited supply of appropriate housing nearby, and we've seen this already in the conversations and the presentations today, and clearly an over-reliance upon emergency out of area placements that last for far too long and ultimately shouldn't be necessary at all. People are placed in settings that don't meet their needs. So these strategies will hopefully seek to change that and influence what gets built and the type and design of a provision, specifically what gets commissioned and what gets funded, where the housing is located, so to make sure that there's accommodation to meet needs all over the country, and to identify whether local areas are able to meet their needs effectively, which isn't largely understood at the moment. And it brings us an opportunity to plan in the long term. So hopefully next year or later next year, the strategies will be published and the government will have a very good idea as to the supply and demand across all of the different boroughs and all of the different local authorities, and can then work with local authorities and the NHS and ICBs to plan long-term housing for people with learning disabilities and autism. And this will enable localities to support community-based and person-centred living, and to allow housing to be built that aligns care and support needs with housing models, and hopefully reduce inappropriate and institutional provision. But as I said previously, all of this heavily depends on whether need is properly understood and how strongly learning disability and autism is reflected in the strategy. It's really crucial that we all get involved in shaping our local strategies, and your local authority will be consulting and talking to stakeholders in the community about the demand for learning disability and autism housing. It's really important that we help the government and the local authorities to understand hidden populations, so people that might be living with parents who may not be able to live with parents for all of their lives, to identify all of this demand, which may translate into a housing need in the future. So it's important that we bring strong evidence.
No, we're on in a PowerPoint now.
I'm sorry?
We're on in a PowerPoint now.
You can't see the PowerPoint? Can everybody else see the PowerPoint?
Yes, Corinda, I think it might be just you, because I can still see it. So sometimes it's good to leave and come back in again if that happens. Joe, just a couple more minutes if that's all
Sure,
right, because
sure,
we're a bit short for time.
absolutely. And yeah, it's about developing the evidence base to show the government and show local authorities what we want and what good looks like, and all of that would enable us to influence the direction, challenge the underestimation of need, which is a continual problem, and deliver housing solutions that really work for people and work also across the system. I'm going to pass over to oh, sorry, John, I didn't know where. Oh, here we are. Here's your slide. I'll pass over to John Verge now to talk about licensing conditions.
Thanks. Can everybody see my slide? I'm the same as Corinda. I can't see any slides either, but on my screen. But
what happens is we've got the front screen, but maybe if could we stop sharing the slides we're sharing and then try again with new slides? Is that okay?
Shall I just reshare and see what happens?
That'd be great, Joe. Yeah, it disappeared for me as well, so I don't know what happened. I could just see your first slide. So
sorry about that,
anyway.
everybody.
Oh, sorry. So can you see that now?
I can now. Yes.
Yes.
Brilliant.
Yeah,
Thanks.
now I can.
Fabulous. Great. Thank you. Oh, good to see you all. John Verge. I'm also a panel member, but my day job is Chief Exec of Golden Lane Housing, and we're a housing association, as Joe mentioned earlier. I'm just going to give a very quick update on another area that the panel are supporting and advising the government on, which is another part of the Act, which is introducing licensing for supported housing. I appreciate many of you may know about this already, so I'm going to give a very sort of headline overview of it. But what it's going to do is introduce licensing for all supported housing where residents, tenants claim housing benefit, except for a number of exemptions, and those are older persons housing, housing that's overseen by Ofsted, and Ofsted is the Office for Standards in Education, Services and Skills. Those services will be exempt from the licensing, and there's a number of others, including domestic abuse and local authority schemes. But majority of supported housing will come under this licensing regime, and the idea is to bring and improve the standards and oversight of supported housing. They're going to be local led licensing in every local authority across the whole of England. Those licensing will last for 5 years, and there will be one single license per provider, but there will clearly be, particularly with larger providers, more than one property on the license, and they'll be listed by their address. I think the key thing to say is around the requirements, and the government did some consultation on the Act last year, and recently, back in April, published their response to that. And part of the requirements of having a license is a fit and proper test for the person who holds the license, and also the directors of the organisation, as well as a named manager for each scheme. Those fit and proper tests are actually going to be enhanced based on the feedback on the consultation, very much aligned with the Care Quality Commission and Ofsted's approach to the fit and proper test. So that ensures that those people who are responsible for supported housing are of a quality, and they are frankly good people to be able to run supported housing schemes. So that's really important. I mentioned it's going to introduce standards, and the licensing will ensure that those standards are met. There's going to be accommodation standards, and there's also going to be support standards. What the government has announced, though, is where it's commission support, and what I mean by commission support, that is where the local authority or the health authority actually pay for that support. There's an expectation that the local authority would not be paying for that support unless it met those standards. So housing associations and other providers who will have a license, they will still need, I believe, to work very closely with the local authority commissioners and the health authority commissioners to get the evidence that they meet those standards, but that won't be a requirement of these licensing regime. The other thing to say is everybody living in supported housing will have to, and frankly they should do already, but they will have to get a license, a needs assessment. And every resident, every tenant will have to have a needs assessment within 4 weeks of moving into a supported housing scheme. The final feedback that we've got from government in terms of the consultation on the introduction of the licensing is that there won't be any discretion to introduce additional licensing conditions by local authorities. This is very much about having consistency and the same type of licensing arrangement across the whole of the country. So hopefully it gives you a flavour, particularly those who haven't been so close to this introduction of licenses. You've got a better idea today of what it's going to look like. The next steps, obviously, are really important to understand what's going to happen next, because these licensing haven't been introduced yet. There needs to be further work on the actual regulations of how the licensing will work. They will be published by the end of this calendar year. So by December 2026, those regulations will be published. It's going to be quite rare situation that they're going to consult on those regulations. Myself and other members of the advisory panel have already seen early sight of those, and we're providing some feedback already into those regulations. But probably for local authorities and housing providers or other providers who have the license, what's going to be critical is that more detailed guidance that will also be published. And again, we will be providing some insight into that. The aim of the licensing is that it's going to go live during and this is a financial year, not a calendar year, but 27-28, which runs from next April to the following March 2028. During that time, licensing will come in. The government have not actually committed to when that will actually happen, but clearly local authorities and providers have got to start planning for that over the next year and a half. And then the final thing to say is after the 3 years, 3 years after the licensing is introduced, there will be an evaluation, which basically means the government and particularly the Secretary of State, who's responsible for this act, need to do their own review of how successful or not successful the licensing has been, to make sure that the standards, both in terms of accommodation and support, have met the requirements of the Act. And obviously a key role of myself and Joe is to make sure that that does happen, because that's really important, and why I was really pleased, and I know Joe was really pleased to be invited to join the panel. I'm going to pause there. Happy to take questions, Claire, offline, probably, given the time, but
Yes.
Hopefully that gives a flavour.
Yes, there's so much going on today, which is brilliant. Thank you so much, both of you. That was really helpful. And there has been some feedback, comments about the resourcing that is needed to enable councils to do this work. And just leading into the next sort of set of items, we would really love to hear from a local authority that perhaps has already started to do this work. And I think at a future meeting, it would be great if we could hear from somebody to share how that's going, what's going well, what's difficult, what people are kind of working through, because that's obviously where it's going to really, we're going to see how it's really going in real places. So thank you so much for that. Jodie, I think you're going to introduce Viv, is that right?
Yeah. So next, I'd like to introduce Viv. So she's the founder of CBF, and she's a parent. And Gary Brulé from Learning Disability England.
Thanks, Jodie. It's Jordan this time from Learning Disability England. So
okay.
No, that's okay. So yes, thank you everybody. I'm a family carer, and presentation, even though my presenter Jordan isn't able to be with us, but he filmed some clips to share with you. And so I'm a family carer, and I'm going to talk about my experiences with my son, who has very complex needs, and Jordan is going to share his own experiences. and we've had some quite complicated messages so far. So the messages in this bit are going to be quite simple messages, but they're sort of core things that we need to remember when we're thinking about housing and planning housing. And so this is about planning housing for and with people with learning disabilities and their families. Next slide, please. So the key message that Jordan and I came up with was that people need a home, not a placement. And it's important to remember that our home is important to all of us. So my home is important to me. Everybody here will have their own home, and that will be important to them. And that's no different to people with for people with learning disabilities. And we need to remember that, because the stories that we've heard so far have been around where it has not been possible for the person to have a home where they are safe, comfortable and relaxed, and they end up in really difficult situations in hospital, and then it takes a long time for them to come out. And so here's two quotes from the same family about an individual. So the first one says, "My son was admitted to Winterbourne View, a mental health hospital, 18 years old. He'd entered into crisis in a pivotal moment in his life as services failed to catch him from falling during transition from school." And then many, many years later, this is a quote from the same family, when he has come out of a range of traumatic experiences in inpatient service, where he now has his own home and is supported by people who know him well and who are able to meet his needs. And the quote is, "He's finally thriving. He's enjoying his life in his home with his dog, and he is cared for by people who do their job so well. He is starting to heal." And there's an important bit at the end of that quote, which is, he was harmed by what he experienced in hospital. And we need to avoid that happening in the future if we get housing right from the start, with the right care and support attached to the housing. Next slide, please. So now we're going to hear Jordan's experiences, and then I'm going to share my experiences of my son getting the housing he needed, and then we're just going to end on some key messages. So hopefully we might claw back a bit of time, Claire.
Hi everyone, I'm Jordan Smith. I've got lived experience of a learning disability, autism and cerebral palsy. I've been in supported housing all my life, but mainly since I was 16. I currently share with 2 other people at the moment, but I've lived in residential care. I've had my own flat. I've lived in different care homes throughout my life. So I've got lots of lived experience of living in different types of housing. I would say that I wasn't given a choice of where to live the first time I went into supported living. It was basically a void's come up, a room's come up here. Can you go and have a look at it? Because it's the only one available. So I wasn't given a choice of where I was going to live and who I was going to live with. And I think that's really important. For those people that don't have a disability, they often get a choice of what house they're going to buy or what house they're going to rent. They look at photos, they suss out the area, they meet their neighbours. But for a lot of people who have care and support needs like us, we don't often get that choice of control. So I'd like to see more choice of control about where we live, who we live with, and what we want to be included in our home. And that includes who supports us in our home. it's really important to that we can call a place a home and have a stable base, because when you've got a stable base, you can build stuff around it, like getting a job, making friends, staying healthy, staying well, and it gives you a base to come back to each day, and you can. It's a starting point for bigger and better things, and like most people with a learning disability or autism, or that are in care and support, we just want to do what everyone else gets to do and live the lives that we choose and that we want to. I would like to see people with lived experience like me of different care and support settings and being in different types of homes to really not just have a seat at the table, but to actively be asked to co-produce stuff, and for that to have meaning, and for our lived experience to be worth something. And so that the only way you really know what it's like to live in these types of homes is if you ask the people that have lived in them. And if you involve more people like us, there's going to be better support for people to live independently, and hopefully there's going to be more homes to choose from, because like me, most of us just want to live in an ordinary house on an ordinary street, like everybody else.
Thank you, Jordan. So that was Jordan's experiences, and so my son has very different needs to Jordan's, but some of the principles are exactly the same. So I'm just going to briefly share my experiences of trying to get the right housing and home for my son. So first of all, there was a complete planning ahead. So there was no thought about planning his housing as we went forward, and unfortunately, because of the level of my son's needs, he was moved to an out of area 52-week school at the age of 9, and that was 275 miles away from his family home. And so once he was there, he was very much out of sight. So it was, he was placed out of area because there was no service that could meet his needs locally. And so it was very much he's out of area, we don't need to think about him now. And so spent a lot of time trying to persuade my local authority to bring him back and to develop the support and the accommodation that he needed, unsuccessfully for 10 years. And certainly when he was due to leave his residential school, there was no planning for him to come back, because they were saying, well, we didn't have anywhere when he was 9 and we haven't got anywhere now. And the approach was very much, where can we put him? And at the time, a care manager was appointed, and she said, oh, we can put him in Wales. And my response was, well, why does he want to go to Wales when we live in Kent? So we did a lot of work, quite a lot, led by his family, to look at developing actually a new support service for him to return to, which was an ordinary house in an ordinary street, as Jordan says, but it was carefully planned. So it was, the whole of the inside was taken out, and it was redesigned so that my son and 3 other people could come from out of area and live in the area where they were born and spent their early childhood. That didn't really work for my son after a little while, because he was telling us that what he wanted and what he needed was to live not sharing with other people. He hadn't chosen, as Jordan said, he hadn't chosen the people that he was living with. They were all of a similar age. They all had very different interests and support needs. And it was actually creating a lot of problems for my son and the other people in terms of them sharing, because they didn't really get on. They didn't really want to spend any time with each other. And that created problems also for the staffing who were trying to support them. So he was telling us very clearly what he wanted and needed, but it was that hard to get people to listen, because he's non-verbal and he can't tell us that, but he tells us it through his behaviour. So we worked really hard. We worked with a housing association. We identified a property, and it was adapted, and my son moved into it and has lived there on his own, apart from with his support team, very successfully for nearly 20 years. And so that's like a success story, but it took a lot to make it happen. And I think it's fair to say that that was driven by his family, not driven by any housing person or any person in the local authority. And certainly there hadn't been, as it says at the beginning, there was no planning for him, because it was just like, well, you know, he's not going to be here, so we don't need to plan for him. And just thinking about, you know, what Joe said, which is, you know, if you're not visible, you're not going to be in those plans. Next slide, please. So Jordan and I have just put together these key messages from our short presentation, which is that right housing for people with disabilities key for living successfully in the community. And many of the families in the campaign families group, where we heard from Emma and Phill earlier, many of their relatives ended up in hospital, not because they needed to be in hospital for any treatment for any mental health condition, but usually because the housing and accommodation where they'd been living was not suitable for them, and it all broke down. So if we get the right housing for people from the start, it will prevent people having to go in, and it will also enable the people who are in to come out. It's important also to note that people with learning disabilities have a range of different housing needs, as we all do. You know, some people, you know, want to live in a flat or in the town. Other people want to live in the country. So it's really, really important to think, actually, there's not one size fits all. We can't create, this is a sort of a place that people with learning disabilities want to live in. We need to think about what is it that this person needs and how can we make that a reality for them. We both feel, Jordan and I both feel really strongly that, you know, people need homes, but they're not placements. You know, I haven't been placed in my home. It's my home. They don't want to be put somewhere, and they don't want to be filling a void, which is, you know, often an expression that a lot of people come across when, you know, whether there's a void here, you can live here. Planning is key from really early stages. So it was, you know, obvious that, you know, my son was going to grow up and going to need somewhere to live. No one apparently, you know, thought about that, you know, when he was a child. And certainly it wasn't, obviously I brought it up during the transition planning in schools, but no one took that seriously. No one did it. And there was still that sort of mentality of thinking, well, we'll find somewhere to put him. You know, we're going to put him in Wales. But also, you know, not only do you need the right, you know, when you're planning, you need the right input. And as Jordan said, you know, people with lived experience need to be inputting into these plans, and also child and adult systems need to join up. As I've said, getting housing right avoids people getting into crisis, and that there is a very, very high human cost for that. But also there's a high financial cost. So it just makes sense on every level. And finally, it shouldn't be so difficult to get the right housing, and you shouldn't have to fail or get to crisis to prove what you need. So, you know, we've got a number of people now who, you know, where families are saying, this accommodation isn't working for my relatives, that, you know, it's not, that's shown with people that where they're not getting on, it's going to break down. And then what happens is it breaks down, and then the person gets admitted into a hospital, and then they stay for 4.5 years, and then they come out and then they get the right house. Well, we don't need to do all of that. We can get housing right from the start. You shouldn't have to fail to prove what you need. And the bottom line at the bottom is include people with learning disabilities and families in all of your housing plans. That's it. Thank you. Hopefully you've made up some time.
Thank you. That's so helpful. Thank you so much for all of you who've contributed to that session. And it feels like it's the beginning of a conversation, and some of the questions in the chat, which we've got such a rich session today, we haven't really got time to come to questions. We'll make sure that we keep a record of any questions and either respond, or at a future meeting we'll use that to inform what we're talking about next time. It would be great if we could have a perspective from a local authority next time, in terms of actually maybe having started to do the strategies, and how people with learning disability and autistic people have been able to inform and participate in that. I'm also really happy to say, I'm sad that we haven't got time for Joe Kane-Smith's session. Joe Kane-Smith is from PPL. We were going to introduce him. He's here on the call, but he is doing some really important work with several local authorities to actually start to develop these strategies. And I'm really pleased that Joe has very kindly offered to come back to a future meeting where we'll be able to perhaps get into a bit more of the detail and to what Joe and his colleagues are doing and how it's going. And I think there's probably going to be a lot of interest in that. If it's okay, I think we'll move on straight to mine Viv's presentation, because we're quite short of time. So Viv, is that okay if we go ahead with our update? We've just got a few minutes left.
Yep, fine with me.
Okay. So thank you everybody so much for what has been a really full meeting. And I think there's been so many calls for action today, and there were also at the conference which Jodie and Viv co-chaired with Sir David Pearson last month, which was all about housing for people with learning disability and autistic people, and why it's really important that we see improvement for people in their lives. So I'll just be 5 minutes on this, and Viv and Jodie, please do chip in if there's anything you want to add. The Learning Disability Autism Housing Coalition is a group of national organisations and some local organisations that have come together to have a unified voice, which means everybody speaking together, dedicated to help people to live good lives in their own homes. And it includes organisations that you'll know about, like the National Housing Federation, Mencap, Learning Disability England, Bristol City Council, LGA ADAS, Challenging Behaviour Foundation, VODG, Look Ahead. And there are some other organisations as well that are part of a wider group supporting the work. So our vision is a society where people with a learning disability and autistic people live in their own homes with the support they need. So it's not just about the people who are stuck in hospital, but we do have a focus at the moment on delivering more specialised supported housing for people, which might include people, does include people who have additional needs, or who might be in hospital or at risk of hospital admission. Next slide, please. So this is almost revisiting, but from a different perspective, some of what Emma was sharing with us earlier. So we know from research that 35,000 homes are needed by 2037. I can provide all of the links after the meeting if you're interested in the research evidence for this. For people with learning disability and autistic people, and the average hospital stay is still 4.6 years. And we also know that over 500 people have been in hospital for more than 2 years. So next slide, please. So this is a reminder of what we're talking about, that every delayed home means a life on hold. Next slide, please. So this is a reminder really of some of the big opportunities that we have right now, which is one of the reasons that we have the coalition, because we think that we've got opportunity right now. The Supported Housing Act we've talked about a lot. We also have extra flexibility in the Social Affordable Homes programme, which is run by Homes England and the GLA. We will revisit this at a future meeting so that we can dive into some of this in a bit more detail. Yes, slides will definitely be shared. And we are asking for rent standard reform to remove the no public subsidy rule, which I can't explain now. We haven't really got time, but it is something which we have talked about at previous meetings, and we definitely will be coming back to at future meetings. At the moment, the government is not minded to make this change, but we're not stopping asking for it because it's one of the most effective and cost-effective changes that we think could be made that would enable more housing to be developed. Next slide, please. So there's also some big opportunities on the health and social care side. So there is the Mental Health Act we know about, that Section 3 reforms are the bit that says that people shouldn't be in hospital just because they have a learning disability or autism, but those changes have not been implemented yet. We need the housing as well as the support to make it possible to switch that on. Maybe an incoming Prime Minister who has expressed interest in both social care and housing. So we're all pricking up our ears and thinking, how can we influence? And neighbourhood health, we've talked about already for future meetings, but real investment in neighbourhood health needs to act on things like housing as well as health and social care. Next slide, please. Yes, there's very little mention of housing or learning disability and autism in neighbourhood health. So we've got a bit of a journey to go on that. So what are we doing? We're campaigning and influencing. We're following up any opportunity we can to work with MPs, ministers, raise awareness with media outlets. Mencap have got that relationship with ITV, and other opportunities like that. Building the evidence base, there's some really active work going on to identify what it really costs for people to be in hospital. I mean financial costs here, supporting people in their own homes and getting it right, but also the human cost. So we're going to be providing a lot more evidence about all of that. And we're developing some webinar materials and planning targeted events to help groups to understand specific aspects of this, like what are the diverse types of housing needs that people might have? What are the design requirements that might be needed? What are the top tips for accessing funding? So yes, lots of sort of education and development that we're planning. I should say this is all being crowdfunded by the organisations involved, several of whom have put a little bit of money in, and quite a few people who are doing it over and above their day jobs. So there's a lot of volunteering going on as well. So that's how we're doing it. Next slide, please. So what should people be doing? Commissioners and housing colleagues should be identifying demand now in the next 5 years, including young people who are transitioning into adulthood. We should be integrating planning, sharing intelligence with local housing needs, identifying opportunities for land, everything Fiona was talking about really. Build those strategic relationships, pick up the phone, develop those connections, and working early with RPs, which is are registered providers, which is housing providers, and to work together on capacity, funding, grant, land, and so on, and build relationships with housing benefit teams to help them understand why this type of housing is needed locally. Next slide, please. This is the final slide. So really it's kind of this group is a really important network to inform the work of the coalition, and we're really keen to understand, have we identified the right priorities? Are there national barriers that you want us to raise that we haven't talked about? Quantitative and qualitative, so that means numbers and real examples of how housing saves money and improves lives. Ultimately make the case to Treasury. And we are working with government colleagues who are interested to have this evidence. Come to the community of practice every 2 months or so, and please spread the word for other people who you think might like to join. And for more information, for now, I've just put my email address on the slides. There are a number of us involved in this, so there are a number of people you could contact. We'll put all of the information on the Learning Disability England website. So I think that's Viv and Jodie, is there anything that I haven't said?
No, I think that's pretty well covered it all.
Yeah.
Thank you, Jodie. So I think we have got back on track, and I think we have got time to hear from Learning Disability England on the new paradigm resources that you're now hosting, which is the REACH standards, isn't it, Rachel? You're going to tell us a bit about that.
I will, if you just give me one moment, because I've now got too many PowerPoints open. So I'll just grab the one that I need. Forgive me, because there are 4. Let's see if it's this one. Just up to the end. I'm going to not find that slide, and I'm just going to tell you about it, because I think that might be.
Thank you.
I'm sure lots of you have heard of Paradigm before, and earlier this year, Sally Warren decided that she wanted to retire and have a bit more time for herself. So Paradigm decided that they wanted to gift Learning Disability England their previous work, and this includes lots of resources and training. And we've been picking up how we want to use that and help more people get involved with that work. So as Claire says, this includes the REACH standards and training, and this is something cited in CQC's Right Support, Right Care, Right Culture guidance. So something that lots of people want to be involved in. So we're looking at how we broaden that training opportunity so more and more people can get involved in it. We're also looking at how we can help more people get involved in co-delivering that. So we're looking for more people with learning disabilities locally who we can help train up to get involved and co-deliver that. So some of you might know people who would be really good at that, and we'd love to hear from them if they're interested. We're also thinking about how we can help kind of train some local people so that capacity exists locally, and then lots of organisations can dip into that. So how we can help kind of a collection of providers work together to come in and do that training. So if you kind of think your local area or your commissioners might be interested in doing something a bit broader than just your organisation, we'd be really happy to chat about how that could work. We have also been working with people with learning disabilities, families and providers to update the Great Support Worker Guide, which is for support workers and thinking about how they can do the best job that they can. And we're looking to launch that in the autumn. So there'll be an online event, which we hope some of you might come along to hear more about what that is and how it can be used. If you're interested in taking up any of the training opportunities, we'd be really glad to hear from you. And we'll have some proper pages up on our website about that soon. But in the meantime, we're really happy to chat about what that could look like and what it means for your organisation. So yeah, thanks, Claire.
Thank
Will
you.
it be on here, Hannah? Rachel?
It won't be on Ticket Tailor, Corinda. So the event will be on Ticket Tailor, but the training won't, because the training will just be for organisations that need it. But the big event will be on Ticket Tailor and everyone can come to that. Does that make sense?
Yeah.
Great.
Thank you. And before I let everyone go, I think Joe Wheeler, you've got something you want to ask everybody about the social care conference.
Yes, thanks, Claire. Thanks, everybody. Just one more slide for you before we leave today. And I'll just share it quickly now. And hopefully it works, because I've only got one slide to share on this matter. So just one moment. We are applying for a workshop at the NCASC National Conference in Liverpool this November, and that stands for National Children's and Adult Social Care Conference. And the application for a workshop at the conference is being made by the Learning Disability and Autism Housing Coalition, referenced earlier by Claire, but also Bristol City Council, where I work. And we're hoping it will be led by Sir David Pearson and supported by the Association of the Directors of Adult Social Services housing lead for this year, Melissa Weiss. And we're focusing on why we aren't building the homes for people that need these homes and what can we do about it. Looking at the specialist housing gap, why delivery of homes is so difficult and what needs to change locally and nationally. And we would like to co-produce this session, and we're looking for people with lived experience and family members to help shape the stories that we use, the examples we use, what messages are going to really land with the government, because the government will be at this conference, and what actions should we be asking system leaders to take. We haven't been given the workshop yet. The application deadline isn't until Thursday, but we should know shortly afterwards if we get a workshop. So we're looking to invite people to become involved and to join a session with me and Claire and others to shape a workshop, so you can share your experiences and insight and help to test and refine the content. The conference isn't till November, so we've got some time, but it would be really fantastic if people who are interested in contributing to this workshop would be able to email me on my email address there, joe.wheeler@bristol.gov.uk. And then once we have some more information, I'll be able to get in touch with you and we can set up our own workshop to design what the conference will look like.
What date is it in November, Joe?
It is, oh, Claire, you've caught me off guard. I would have to Google that, but I can do that now if you'd like. So
perhaps if you Google it and just stick it in the chat, that would be really good.
Yes, so it would be either the 11th or 12th of November 2026.
Great. So that is a really good, that is a conference that a lot of the people who we want to influence come to. So it is quite important for us. Hopefully we might get that session. Thank you very much. Okay, Joe, did you want to say thank you to everyone and finish us off?
Yeah, so thank you everyone. It's been amazing to see you all, and thank you to all the speakers and all the organisers. Okay, so thank you.
Thank you, everyone. Bye-bye. See you next time.
Okay, bye.